I well remember as a child drinking rice water. That was a local cure for measles. Just as we don't hear about mumps, I remember eating the salted potato tied around my chin for mumps. These things are all matters of the past, and this has come about by collective action by international organizations. So the eradication of polio was a collective action of the people of the Americas, guided by PAHO. The ultimate eradication of measles is ongoing, but it is an collective action by the Pan American Health Organization with governments for the eradication of measles. Nearer home here in the Caribbean, we know that we have had a tradition of collective action, not only in healthcare, but in politics. And as we know, it is this thinking that has led to the formation of the Caribbean community and to the other groupings in our region, which has led to PAHO, led to CARICOM, as we know it, to the OECS, as we know it, and to a host of other collective arrangements. But ladies and gentlemen, I'm here to tell you that this collaboration has been going on for some time, for a long time, before we formalized it. The Caribbean has an interesting history. Before we started putting walls around each island, our people moved freely, and we shared freely among ourselves. Now, the minute you say, do this formally, then we get caught up in a lot of bureaucracy and problems which does not allow us often to share as much and as far as we should. So now we have treaties, the Treaty of Bastia, the revised Treaty of Chaguaramas, and the revised treaty of this and the revised treaty of that, which then creates supra laws in our administration. And we now have to administer these. And some people apply them and some people don't, as we know. But what is not so well known in the international world, the national healthcare world, is an initiative which is known in WHO as Caribbean Cooperation in Health. We refer to it as CCH. It is now in its third generation. This initiative was born out of a recognition of challenging the conditions faced by the health systems in the CARICOM member countries and the need to find solutions to overcome or to mitigate the difficulties and challenges facing our small island states and economies. A significant plank in the notion of the Caribbean cooperation in health is that of, and I quote, the sharing of resources for the delivery of services within countries and between countries. An area of health services that lends itself admirably to this notion of Caribbean cooperation and sharing is in the provision of cancer services. Its primary prevention, its screening, its early detection, diagnosis, treatment, and palliative care. And this is so because we know that cancer is the second leading cause of death in the region of the Americas. And in some of our territories, it is in fact the leading cause of death. A couple of years ago, for instance, there was an estimated 2.5 million new cases annually, and with 1.2 cancer deaths annually. And these figures are likely to persist in an area where we are witnessing the phenomenon of an aging population and what has been called the epidemiological transition. That is the structure of our societies and of our populations that is mimicking first world countries. Given this scenario, it is projected that the cancer burden will increase significantly over the years. And yet, the scientific evidence suggests that 40% of cancers can be prevented through reduction of risk factors and primary prevention, while a further 30% can be cured if detected early and treated appropriately. Ladies and gentlemen, it is against this background that the policy decision taken in 2009 by our own Prime Minister, Dr. the Honorable Baldwin Spencer, to give support at his level, which is at the highest level of the government, to the establishment in Antigua of a cancer center for the Eastern Caribbean can be seen as extremely timely and is in keeping with the current thinking of the technocrats at the international level. By taking this initiative, the Honorable Prime Minister was ensuring that this notable idea did not go a-begging for the lack of political support at the highest level. The political will was clearly heralded. In this case, the hurdle of political will was scaled, as our Prime Minister not only saw and appreciated the need to have the facility established here for the treatment of cancer patients, but also led the way, supported by the technical data, in his personally seeking a buy-in by his OECS counterparts as he attended the various regional and sub-regional meetings. And he has obviously done so with some degree of success, hence why we're here this morning. Given the political will, the Prime Minister further saw the wisdom in this highly technical area of giving his blessing to the forging of a private-public partnership while maintaining government's regulatory role in the construction and operation of the facility. Recently, the United Nations have been devoting much effort in highlighting the need to pay attention to the increase in chronic non-communicable diseases. And through the Pan American Health Organization, has called for cancer prevention and control to be an integral part of a country's chronic disease program. Therefore, another spin-off for having the cancer center here will be the enhancement of primary prevention in the treatment and control of cancer. Activities surrounding the center will be heightened awareness of the incidence of such chronic diseases, as for example hypertension and diabetes, their causes and effects, and so lend support to the effort of public and private entities, NGOs and others, as they work toward primary prevention, screening and early detection. The board of the Cancer Center is comprised of a mix of international partners as well as a number of our own Antiguan and Barbudan nationals. The latter will maintain a direct relationship with the board of the Mount St. John's Medical Center. This should prove to be a strategic arrangement, since there is no doubt that there will be a symbiotic and complementary relationship between the Cancer Center and our hospital here at Mount St. John's Medical Center. The external partners for the Cancer Center include a team of eminent technical and professional personnel, and the board is headed by a distinguished professor of oncology, Dr. Arthur Porter. And I know him well enough, so I'll say bow tie and all. I've never known him without his bow tie. Who until recently was the Director General and the CEO of Canada's McGill University Health Center, with a complement of some 12,000 employees. He has with him on the board Professor Carol Sikora from the Hammersmith Hospital in London. And those of you who know anything about London know that the Hammersmith Hospital, as we say in Jamaica, is not a piao hospital. And we have, supporting them, Dr. Conville Brown from the Cancer Center in the Bahamas. Welcome, gentlemen. Doctors Porter and Brown are no strangers to us in Antigua, as they have been teaming up with our staff at the Mount St. John. I still say our staff, even though I'm now retired. Our staff at Mount St. John Medical Center for a couple of years now, offering cancer services to our patients. Now, the facility to be built here promises to become a center of excellence in our sub-region and should fill a hitherto underserved area of our healthcare services, not only to our nationals in Antigua and Barbuda, but also to many of our brothers and sisters in the OECS. Like others, I am eagerly awaiting for the commissioning of the center later this year, and wish to congratulate all those responsible, including the Honorable Prime Minister, for bringing this project to this stage of development. I wish them well.